Welcome to Anatomy in Nutshell. In this video, we are going to see atypical thoracic vertebrae. The typical thoracic vertebra features already described in a separate video. I will give the link in the description box as well as in the I button. Please watch the video. And the atypical thoracic vertebrae are first, 9th, 10th, 11th, 12th thoracic vertebrae. The features of the first thoracic vertebra, we are going to tell only the distinguishing features from the typical thoracic vertebra. So it resembles like that of the 7th cervical vertebra. The body is narrow anteroposteriorly. Its upper surface is concave from side to side with an upward projecting lip on the either side. So the anterior border of the inferior surface projects downward. Coming to the superior articular facet on the each side of the body is circular and articulates with the whole of the facet on the head of the first rib. So the superior articular facet articulates with the head of the first rib. The superior vertebral notches are deeper as in the cervical vertebra. The inferior articular facet is half and articulates with the head of the second rib. So the demifacet present. So the superior articular facet articulates with the numerically corresponding rib. The inferior articular facet is demifacet, articulates with the head of the second rib. The spinous process is nearly horizontal. Superior vertebral notches are deep. The 9th thoracic vertebra, the lower costal facet on each side of the body is absent. So only one facet for the numerically corresponding rib. The superior costal facet articulates with the 9th rib on either side. The 10th thoracic vertebra, the body on each side possesses single articular facet for the 10th rib. So the costal facet encroaches on the upper part of the pedicle. The 11th thoracic vertebra has only one facet for the articulation of the 11th rib, the head of the 11th rib. And the transverse processes are very small in the 11th rib but do not present a costal facet on their tips, because there is no tubercle on the 11th rib. 12th thoracic vertebra. It resembles that of the first lumbar vertebra. So the body on each side possesses a long single costal facet for the articulation of the rib, that is the 12th rib. The transverse process is small and present three tubercles, superior, middle and the inferior. It has no articular facet because there is no tubercle on the 12th rib. So the three tubercles present on the transverse process of the 12th thoracic vertebra correspond to the three processes of the lumbar vertebra. That is, superior tubercle corresponds to mammillary process, middle tubercle corresponds to transverse process and inferior tubercle corresponds to accessory process of the lumbar vertebra. This is an important distinction feature of the 12th thoracic vertebra from the typical vertebra. Thanks for watching. Watch more videos in the Anatomy in Nutshell channel.